Medication management for patients and caregivers, Module 6. In Module 6, we're going to be talking about managing side effects and drug interactions. This presentation is brought to you by my web pharmacist, and the presenter is Dr. Olufemi Williams, a pharmacist. My web pharmacist supports men and women 40 years and above in safely managing their loved ones' medications, minimizing risks from side effects and interactions. And this is who the course is for, and this is the format. Course objectives: empower patients and caregivers to safely manage medications, improve understanding of medication use and adherence, build skills to prevent medication errors, and manage side effects. And we want to promote the active participation in healthcare decisions. We want the patient and the caregivers to be actively involved in healthcare decisions. So, what are we going to be doing in Module 6? It's managing side effects and drug interactions. The learning outcomes: identify common side effects and know how to manage them, understand how to prevent harmful drug interactions. And again, in Module 6, I'll be showing you um, a medication profile and some other things. Okay, there will be three topics: common side effects of medications and what to do about them, how to recognize serious side effects that need medical attention, drug interactions, what you should know before taking new medications, and talking to your pharmacist about potential risks. So, the most common side effects of medications are nausea, dizziness, dry mouth, stomach upset. And this usually occurs for different reasons. Sometimes the body is adjusting to the medication or to the dosage. Maybe the dose is increased. Now, nausea, like you feel as if you want to vomit, but it's just slight. So your stomach is trying to adjust because this is not food, so it's trying to adjust to it. Dizziness. Sometimes the medication could cause dizziness. It's probably affecting your blood pressure. Sometimes if it goes too low, you could be dizzy. Sometimes it's affecting some things in your brain. So as your brain is trying to adjust and your body is trying to adjust, you might feel dizziness. Usually there'll be a sticker on the bottle telling you that this might cause dizziness. So until your body adjusts to that medication, we always advise: don't drive, don't handle heavy machinery. Dry mouth. Now, some medications, the way they work, they try to reduce the secretion in your body. So if that happens, you also feel it in the mouth, and then you feel the dry mouth. And then the stomach upset, like I mentioned in the last module, metformin is very um, notorious for that. And things like aspirin, yeah, so those ones could cause side effects and even could cause bleeding. So why do they occur? Because the body is adjusting. And what are you supposed to do? There's some medications we always advise that you take them with food or after food, so that to reduce the effect on your stomach lining. Then some medications will tell you to change the form you are taking. If you are taking just the regular medication, we might tell you to take a coated one, or we might tell you to take an extended release one. So it depends on what medication it is. So that's why it's always good to call your pharmacist and ask how exactly you should take your medication. And sometimes it might not be serious and it's something you can take care of at home. But if you are not sure, please call your healthcare provider. Now, so recognizing serious side effects versus allergies. So there are different things. Some people When they have a very bad side effect, they think they have an allergy. But they are two different things. So allergies can range from mild to life threatening. So the signs of an allergy includes hives. When you have hives, it is most likely an allergy and not a side effect. A rash, swollen lips, tongue, or face. If your face swells up, if your tongue swells up, if you're wheezing and having itchy skin or eyes, that is most likely an allergy, and you should call your healthcare provider immediately so that they can stop it, tell you what to do, and change your medication. So you must always do that. Always call once you're having wheezing, you can't breathe, you're having a rash, swollen lips, swollen tongue. Please, please, please call your doctor or go to the emergency room so that they can give you something to counteract these reactions. Serious side effects are just, it could be, like I said, could be bleeding. Um, Sometimes for medications that like blood thinners, when you see bruises, unexplained bruises on your skin, it could be that it's the blood thinner is, the dose is too high for you, and then your blood vessels are erupting under the skin. So if you see unexplained bruising on your body, especially those who are light colored can see it easily, that means the doctor has to adjust your dose. So there's so many things. Just reach out to the pharmacist and we'll explain to you what's going on. And if we think you should see the doctor, or if it's easier to get to the doctor or emergency room, just reach out as quickly as possible. So, understanding drug interactions. How do they happen? So, when two drugs affect each other's effectiveness or cause harm, that is what we call drug interaction. So, if a drug brings down the effectiveness of another drug, or increases the effectiveness of another drug, or some creates a brand new chemical, that is a drug interaction. So talk to your pharmacist or doctor about any potential interactions, and keep track of all your medications, including over the counter herbal remedies and supplements. Again, I'll show you what I showed you last time in the and I told you that I'll send you a link so that you can create your own medication profile. So this is the example of someone, Mr. Wellness. He put his drugs, his conditions, his allergies, and the report comes up. So you can go back to module 5 and you'll be able to see all that I showed you there in module 5. So, so I said show medication profile. So that's it. And for those of you who join the my web pharmacist community, you'll be able to get a free link to create your own medication profile, just as I said. And there, you'll be able to put in your medications, you add your medications, add your health conditions, add your allergies, and it will provide a report to you to know if there's any interaction or if what you should do. And you can also have an app. You can have an app on your phone, which you can always take to your doctor's office. So that concludes module 6. Please join us in the community so that you can ask questions. You can ask the pharmacist questions through direct message, and we'll be there for you. So that's in school.com/mywebpharmacist. And for those attending a live workshop, this is the time to ask question and answers. But even if you are listening to the recording, you can access our pharmacist on school.com/mywebpharmacist. This is brought to you by my web pharmacist. We support men and women 40 years and above in safely managing their loved ones' medications, minimizing risks from side effects and interactions. And this was presented by Dr. Olufemi Williams. So, in Module 7, what are we going to be talking about? Medication management for chronic conditions. Learn how to manage medications for chronic conditions such as diabetes, heart disease, or asthma or respiratory diseases. Understand the long-term importance of medication adherence. And we are going to be having 4 topics: managing medications for diabetes, hypertension, asthma, and other chronic conditions, understanding how lifestyle changes can impact medication use, monitoring progress, how to track symptoms and adjust medications as needed, caregiver tips for managing medications in chronic illness. So that's what we are going to be doing in Module 7. And we hope to see you in the school community where you can ask our pharmacists any questions you have, and we'll be there. Okay.